I came to a point where I just didn't want to have children anymore, or even want to try, in the aspect of the word try.
A high-risk pregnancy are those that where the mom has additional medical complications, and really that even includes things such as diabetes and hypertension, thyroid disease, really any number of things, including some very common diseases that we just mentioned, but also some that are less common. But in addition to problems that mom might have, it also is going to include problems that the baby may have that we diagnose in utero.
Getting pregnant wasn't the issue. The issue is, I guess, keeping the babies. Because our first pregnancy ended at 21 weeks, and we actually had a vaginal birth, got to see her and everything. And the rest of them were preterm. Not necessarily preterm, but in the essence of, you know, them being delivered, but just early miscarriages at 6 weeks.
We are the only practice in town that does high-risk obstetrics or maternal fetal medicine. So we have our group at the medical university who will deliver and take care of low-risk pregnancies. And while we do some of that, really our focus is going to be on the high-risk pregnancies. So we take care of the moms that have additional medical complications, the babies that have problems. We do that for the obstetrical care, but we also spend a lot of time doing prenatal diagnosis. So doing ultrasounds that might look for any problems on the baby, doing procedures that might help diagnose some of those problems, and then just really doing consults to help the patients and the referring doctors just know what they can do to fine-tune.
The people we see are people who are at increased risk to have a baby with birth defects, who may have a baby with birth defects, or may think that they're at increased risk for a baby with birth defects.
We were very confused. I think one of the first things I asked her, was, did I do something? Had I eaten something or done something wrong? And she was so kind and, very comforting that this was a random mutation.
So even if there's not anything we can really do to change the outcome, I think we have a lot of resources just to help patients really understand what the problem is as they're going through the pregnancy, and then understand how to make decisions about it.
I kind of joke with patients that after I talk to them about whatever their indication is for being here, like it might be the mother's age or a family history of a problem or an abnormal screening test, then I show them my menu because there's so many testing options now that it's very complicated, and people need to know what's available, need to understand what's available, the benefits and the limitations of the risk with what's available.
In addition, especially on the patients that develop problems, we have to reach out and we have to talk to neonatologists or the baby doctors who specialize in complicated preterm or complicated births, or sometimes we talk to different pediatric surgeons. So we have to pull everybody together, really make a plan for how we're going to deliver that patient, make sure that we're all in the same place at the right time.
It just really helps to have people around you that are wise and trustworthy, that you can trust them, and that the counsel that they're giving you is wise, and they know what they're doing, and they've done it before. And though you feel like you're the only one that's ever gone through this, they've seen things before and, can kind of help you as you stumble.
I feel like they've been doing a wonderful job. They did. They took the time to kind of figure out, or try to at least figure out what was going on, what the problem was.
It's so rewarding. They're so happy. They're so grateful, and it's nice for us to know that we helped them to get through that difficult time, and then they were able to have that success during the next one.